Constipation is a biggie with me. I'm a great advocate in preventing this. Again, with a bowel that's not functioning properly, think of it as something where the motility is not there, it's not pushing along, and if it's got some harder stool in there, or it's just not got enough water in there, or there's lots of, and the water's been sucked out more because it's been a bit more stagnant, you've got constipation. So constipation is an interesting thing. I can have many parents say to me, my child isn't constipated, like the stool's not hard, it's quite soft, but he's having a really hard job, or she is pushing it out. And again, there's the pushing out at the end, which is probably a problem for kids with charge. We were talking about toilet training before, but it's certainly a problem. And parents have come to me over the years and said, I'm not sure my child with charge can feel that well down there, and feels it. And I think it's a bit like the top end. I think the bottom end needs to be trained. I think it's the only way of doing it. I mean, you can do some stretching, you can do there isn't much else to do. You can try and keep the stool as soft as possible, and then the training. I mean, again, as a pediatrician, I see a lot of kids with constipation. It's bread and butter in my clinic. So essentially, I look at what are they eating, so nutrition, trying to keep away from fast foods, from foods that have got a lot of additives in them, increasing the fiber, making sure they're drinking enough water, enough fluids, probably on something like a softener, like Miralax, PEG, polyethylene glycol, it's given lots of names, laxadase, and a pusher outer like Senna. Senecot is a great pusher outer, so a combination of the two. They need to be on that because the bowel's not working properly. You can try all the behavioral stuff, and then going to the toilet regularly behaviorally, having some sort of reward system set up, looking at regulating, a bit like you look at regulating the swallowing, whether it's an iPad app, whether it's something that you can use to sort of, and then with of course with rewards, and the reward at the end of the day is rewarding because you're working on toilet training, and it's hopefully going to work. A hard one to work on that with an OT. But I think from a pediatric point of view, looking at preventing constipation, looking at constipation not just being hard stool, but being stool that's not being pushed out properly is important. And another point that we've discussed today that's been brought up to me is that, and I think by error, it's not in a lot of my literature and needs to be put in, is the problem with obstruction, bowel obstruction. We're seeing that more in charge syndrome, certainly as the kids grow up. These are kids that probably have been literally kept alive by you know, the miracle of medicine, of their families, of everything, of more knowledge. And they have had more operations maybe. Their guts are more prone to this. Their guts, when in embryology, your gut is actually, again, I'll try and put a picture of that, is positioned in the body cavity in a way that it doesn't rotate, that it doesn't twist or go into itself. So again, there can be probable problems with that. We don't know, but we're guessing. But certainly, if you've got adhesions and if you've had a gut that's been disturbed by surgery, you're going to be more prone to having bowel obstruction. That's for anybody. But there is also the other aspect of probably that gut is anatomical, like we'll go back to the anatomy of the face and the tonsils. They may be completely normal, but it's the anatomy of everything that's not quite right, and it doesn't have to be that wrong to cause problems. So bowel obstruction, volvulus, intussusception, those things that can happen with a gut that's not working properly.